Today I am going to be doing a clean dressing change for our patient. If this were a real scenario, I would have a provider order in front of me and it would let me know that it is time to change the dressing. And if my patient was real, I would ask them their pain level and I would get them, I would assist them into a comfortable position for this dressing change. I'd make sure that I have the correct patient, provide for privacy, and do my safety check. And I have all of my equipment gathered. I'm going to perform my hand hygiene, and then I'm going to put on clean gloves. And throughout this, I'm going to do my best to avoid contaminating anything, so trying to avoid crossing over the field. Okay, so I am going to begin by gently removing my tape, and I'm doing the push-pull method, again trying to avoid ripping any skin or damaging the skin around it. And right when I take this off, I'm going to assess the pad for any exudate. Anything that's yellow or kind of pussy looking, purulent, or anything other than like a clear or pinkish drainage is pretty alarming for infection. So I would note that it looks to be clean and I do not see anything that are signs of infection. The wound is pink and it is red and moist. The peri wound around it looks healthy. There's just a tiny bit of inflammation, but nothing that appears to be worrisome. And then my drainage is clear. So I'm going to throw this away and also discard my gloves. And I'm going to perform my hand hygiene again and put on new gloves. Right. Gloves are being put on. And the next thing we're going to do is we are going to measure our wound. So I have a little ruler and then some Q-tips to measure it. So the way that we measure our depth is by taking the Q-tip and inserting it into the deepest part of the wound, and then bringing our fingers down and seeing how deep that is. And then on this, there's a handy little guide. Right, and it looks like this is 1 centimeter in depth. And if I were obtaining a wound culture, I would swipe the wound with the Q-tip and then break it into a little container to send off to the lab. And I'm discarding that. And then I'm gonna measure the length and the width of the wound. Okay, so my ruler only goes to 8 inches, but it looks like, well, hold it there. It looks about to be like 10 inches in length, and then across, it is about 2.5 inches in width. Okay, and if I were to irrigate the wound, I would take the saline solution and I would go from the least infected part to the most infected part to avoid contaminating any of that. And next we are going to clean the wound. So I'm going to take this sterile water and I'm going to lip it. Take this, lipping it. And then we ran out of our big gauze container, so I'm just gonna pour a little bit onto the gauze there. And I'm also going to put on new gloves and do my hand hygiene again. So we're going to clean it, and again with the same as the irrigation with the sterile water, we're going to go from least infected to most infected to avoid that spreading that infection at all. Get these gloves on. Alright, so I'm taking my gauze, I'm picking it up like so. Dragging the corners in like that, and then I am going to clean one side, and then I'm throwing that in the trash, and then again I'm bringing the corners in to create a little kind of pocket, and I'm doing the other side, dragging from least infected to most infected, throwing that away. And then I'm taking my last piece, and I am going to do the middle. And I'm again throwing that away. Okay, and now we are going to pack our wound. And I'm going to change my gloves again. I'm taking one last gauze pad, and I'm going to put that inside the wound. And I'm just folding it up like that so it fits nicely in the wound. And I'm going to pack it and make sure that it's nicely in there. And then we are going to take our gauze pad, trying to stay sterile, and I'm keeping the blue line up to help with the moisture absorption. And then lastly, I'm taking my tape, and to help the future nurse who's going to be doing the dressing change, I'm going to fold these pieces over. That way it's a little bit easier to take the tape off, and it doesn't hurt as much for the patient. And I'm just gently applying this tape, making sure that I'm not like pressing too hard on the wound. Again, folding over the pieces. This is a little difficult with gloves on. And now that I have my wound all packed and dressed, I'm going to put my initials and the date and time. It is the 11th, and the time is 4:30. And then I would make sure that I would properly discard all of this into the trash. And I would be documenting all of my findings, and then I would come back in shortly to assess how the patient is adjusting to the new dressing change. And that's it.